I'm Yvonne Okwara Matole. Let's get straight to our top story tonight. The National Nurses Association of Kenya has dismissed a report blaming nurse Mary Wahome over a surgery mix-up at the Kenyatta National Hospital. The association has termed a preliminary report by the Kenya Medical Practitioners and Dentists Board a futile attempt at cleansing the image of the board. Here's Rita Tinina with that report.
After last Thursday's inquiry into the surgery mix-up at the Kenyatta National Hospital, the Kenya Medical Practitioners and Dentists Board gave its verdict.
The competence of the Dr. Anson Nganga Kamau, who undertook the surgery of the patient, assisted by Dr. Mose Mora, could not be questioned as his team reviewed the document presented to them in theatre appropriately.
The committee heaped the blame on Mary Wahome, the nurse who labeled the patient in the surgery mix-up.
The capability of one nurse, Mary Wahome, to work in specific units of the hospital needs to be considered by her regulator, the Nursing Council of Kenya.
Now, nurses are fighting back. The National Nurses Association of Kenya has come to the defense of one of their own, questioning the legality of the preliminary inquiry. In a statement, the association's chairman, Alfred Obuya, says, as nurses, we view that preliminary inquiry process and report as skewed to favor the doctors and a futile attempt to cleanse themselves in the court of public opinion. The Joint Committee, which absolved the doctors of blame, sat for more than 8 hours and heard from 11 witnesses last Thursday before giving its verdict on Friday. The Nurses Association says it's technically impossible to pretend to come out with any iota of substantive findings within 24 hours on an issue of such magnitude. That as the country awaits a report by the Parliamentary Committee on Health, which last week grilled Health Cabinet Secretary Cecily Kariuki, suspended KNH CEO Lily Koros, and medics involved in the surgery, among them nurse Mary Wahome.
But on that material day, we had admitted 10 patients, 2 nurses on duty.
The National Nurses Association of Kenya does not indicate what next step it will take over the issue, as KNH, the country's largest referral hospital, remains in the spotlight for the wrong reasons again. Rita Tinina, KTN News.
And just to clarify, that decision was not just by the Kenya Medical Practitioners and Dentists Board, but rather a special preliminary committee of all 3 cadres comprising the Medical Board, the Nursing Council, and the Clinical Officers Council of Kenya that made that decision, bringing together all the 3 cadres of those that were involved in that incident at the Kenyatta National Hospital. So who